Councillor Craig. Councillor Deutschman. Here. Chair Erb.
Here.
Councillor Foxton.
Present.
Councillor Harris. Councillor Hunick.
Present.
Councillor James. Councillor Liggett. Councillor McCabe. Councillor Nowak. Councillor Solonen.
Present.
Councillor Shantz.
Present.
Councillor Verbanovic. Councillor Williams.
Present.
Councillor Wolf.
Present.
Thank you. So for the benefit of those who are watching online, we do have a quorum, even though there were some people that weren't present for the roll call. As we begin this meeting, we're again reminded that many of our homes and places of employment are situated on the land that is the traditional territory of the Haudenosaunee and Nabashabi and neutral people. We recognize and deeply appreciate their historic connection to Waterloo region, and we also recognize the contributions Indigenous peoples have made in shaping and strengthening this community. We are grateful for the opportunity to live and work here and reaffirm our collective commitment to keep the promise and challenge of truth and reconciliation real and intentional in our region. Are there any declarations of pecuniary interest under the Municipal Conflict of Interest Act? None. We have no presentations. We have one delegation registered, Jeff Wilmer, who is going to be online, as I understand it. Is he in the waiting room? Do we know? He is? Oh, there. Hi, Jeff. Welcome. Just as a reminder, we'd remind you, which I don't think this is anything new to you, if you conduct yourself in any one of the following manners, it will result in an immediate and removal from the meeting: interrupting councillors, staff, or other delegations, derogatory statements about councillors, staff, or others, turning your camera on at an inappropriate times, and hate speech or defamatory comments. And please don't take any offense if, following your presentation, there are no questions from council. This is council's time to listen and reflect upon the opinions and ideas shared with us from our community members. Thank you, Jeff. You have 5 minutes.
Thank you, Chair Erb. Good afternoon, members of committee. So I was at Regional Committee 3 weeks ago to present a funding request from a Better Tent City. And you have that request in writing as well from the committee meeting 3 weeks ago. So I won't take time to repeat that. My intent today was, because there's now a report before you, which is item 712, that lists the community funding requests in the housing system. And we are mentioned in that, and the quantum of our request. I thought it would be appropriate time to be here to answer any questions that you may have, since you now see our request in the context of the other housing sector requests and in the context of all the other matters before you in the budget. So I don't really have a presentation. I'm really just here to answer in case you have any questions.
Thank you. Are there any questions from committee members to Mr. Wilmer? I don't see any hands being raised, so I think what I'll do with committee's permission, the report that Mr. Wilmer was referring to is Community Services Report 23005, 7.1.2 on the agenda. We'll bring that forward and deal with that now while Mr. Wilmer is here. And I'll invite Mr. Sweeney to speak to that, and Mr. Dyer, if necessary, as well. Mr. Sweeney?
Thank you, Chair Erb, and through you. So there is a report in your package where staff are seeking direction today. As a reminder, Mr. Wilmer acknowledged he was here a few weeks ago. Just prior to that, we also had another delegation from another provider in the housing stability system that brought forward through a delegation a request for some funding So what staff have done is we have gone back and looked at the numerous requests that we received throughout 2022 from our providers for additional funding over and above the existing envelope. And in an attempt to ensure transparency and equity in this process, felt if we were going to come back with information that we would give you the full picture and context. Given the budget challenges, particularly with respect to the ceasing of the SSRF funding, these requests are not in our current budget that you have been considering for some time and will continue to consider again tomorrow and leading up to February 22nd. So from staff's perspective, we felt there were two options to give for you today to seek your direction, and they are before you, and that is providing direction to staff to add a quantum of funds to the existing budget up to that $1.8 million figure that would then provide staff with the opportunity to go and do further due diligence and have further conversations with providers and have then the flexibility to add those into the 2023 budget. Or of course, another option would be to not add these into the current budget, and we would stay the course with what is before you so far. So that's what we're looking for direction on, and I'm happy to answer any questions both on the approach we've taken or anything else related to this. I will say, however, that staff have not had the opportunity to fully vet each and every one of these proposals, so I'm not in a position to provide you today with the relative merits of one versus another. There is a process that we have that we work with our providers to go through, and that would be the ongoing process that we would undertake. So just maybe I'll leave that there and see if there's any questions, comments, or feedback from members of council.
Councillor Foxton.
Thank you, through the chair. And Mr. Dyer, what would the 1.852 equate to in a tax increase?
Mr. Dyer.
Approximate, just approximate.
So through the chair, let's say about 0.3%. So 1% is about $6.3 million, and we're talking about 1.8 if the entire 1.8 was to be added.
And if I may, sir, Peter, you haven't vented these, but don't you think we should have had them vented? We need them vented, I think, before we decide on budget day as to what should fall where, in your opinion. I would like your opinion on these by budget day before we make that final decision.
I appreciate that, Councillor Foxton. On behalf of staff, that will be challenging for me to commit to this evening for us to do a full deep dive on each and every one of these requests prior to February 22nd.
Okay, but there's one here for, they wanted gift cards for Christmas, so we can probably take that one out because we missed Christmas. Right, so. I would prefer, Councillor Foxton, I don't have all of the information with each and every one of these to be able to weigh, again, to weigh their relative merits versus the work that we have to do. This involves, and we've had a very good conversation. My colleagues from housing staff are here today, Ryan and Kellyanne, with the leadership at One Roof, and we're starting to really dig into the nature of those requests to put some more context to those. But I would be remiss if I wouldn't like to overpromise, Councillor Foxton, that we can do a full due diligence on all of these, in addition to all the additional work that's going on before February 22nd, which is why we've formulated the option for direction here today to be able to simply add that. We would then undertake the proper due diligence, and those that staff felt had the appropriate merit would then roll into the budget. And if there was any difference between the quantum that council potentially would add this evening it is this evening, isn't it? This evening, and what does not get funded would just carry through as a variance for the rest of the year.
Okay, that's good enough for me. So you are going to look through them and give us some kind of direction.
Depending on the direction we get this evening.
Thank you.
Thank you.
Councillor Deutschman.
Thank you, Chair. So just the One Roof, first of all, I appreciate that you have been having meetings with One Roof. There are a number of various proposals that they have, so presumably some vetting process is going on there. On the security one, though, and I see it says annualized, which when I see annualized, I take that to mean potentially baked into our tax rate. But my impression was that their issue is, indirectly connected to the activity that's going on at that end of Kitchener, a little farther down. And I didn't get the sense that that was permanent, that was happening at that end of Kitchener. We're talking about it, Montgomery and Weber, right? So that this would be, if it's 2 years with respect to that other, this is sort of tied to, like, the result of the request for security is more tied to that. So I didn't see it as an annualized ask, but is that something that your team is saying that they're asking for it to be annualized?
No, to be clear, when we put this chart together, we were looking at, are these discrete and specific one-time asks, or are they intended to be, and was the nature of the ask intended to be baked into base? I acknowledge your point that some of these may not be as long-term if they're circumstantial, and so that would be part of our analysis.
Yeah.
But the idea here is that we wanted to be transparent that in potentially adding these, we are potentially adding annualized costs going forward. That's all we were getting.
Absolutely, but on this one, with respect to security, I don't believe it was intended to be annualized.
Again, I would have to have that conversation with the executive director or go through staff. But again,
Right.
I appreciate your point.
Well, I'm just giving you direction, right? You're asking for direction, so I'm saying I don't think this is an annualized ask here, so
That's-
that changes the perspective of it.
It potentially changes the quantum, correct?
Yeah,
Yes.
yeah, thank you.
Councillor Wolf.
Through you, Mr. Chair. I think we've all been impressed by the great needs in this housing, and I would vote for the option where you're looking at the 1.8 million and thoroughly vetting the requests, but having the option to grant them. Thank you. And does that just be a comment, or do I, as a direction, or wait
Well-
for everybody else to comment?
I have a number of other speakers, so
Yes.
I'm wondering if we could deal with the speakers first.
Sure.
Chair Redmond.
Thank you. And Chair, just for clarification, I didn't quite catch the tail end of what Councillor Wolf was saying. What is she suggesting?
Do you want to repeat? I don't want to put words in your mouth.
They might be better that way. Through you, Chair. Mr. Sweeney gave us two options. And one option is the option to allow $1.8 million for these different housing requests that he and his staff would vet and distribute the money to those that he felt were legitimate or worthwhile. And with the great need that we've seen and those we've heard, I know myself and many other councillors have been going to different organizations, and we're getting many requests. And we see there's much need, and I think the 1.8 million and where it comes from, whether it's a reserve or the levy, I think it's important that we do it.
Thank you. And can I just say that this is a very difficult proposition because everybody on this list are valued partners that we know that we depend on to deliver very, very important services. I do have to say that I question the 1.8 million. That is the size of the ask, but if I look, One Roof is pretty much asking for 50% of that. And I didn't ask this question when they presented, and I wish I had. And it sounded to me like they were asking for additional staff people to work at One Roof as opposed to engaging an external security partner or somebody who we have hired traditionally. So I would imagine it would be really difficult after 1 or 2 years to say that that was just a temporary addition to their staff, because we all hope that the need for all of these services diminishes, but I don't know if I put a lot of faith in that. So I guess the question I would ask through you, Mr. Chair, to Mr. Sweeney or other staff that are in the audience who know this whole support system a lot better than I do. I'm certainly no expert. I have been counseled that there are different junctures along the way where if we can relieve some of the pressure, it helps open up the continuum of going from homelessness to shelter to supportive to affordable. And I'm wondering if that lens is ever looked at through these different partnerships. And additionally, I guess my little soapbox is, are we providing services that would be better going with these partners to advocate to the province and to the federal government if indeed what we're doing is backfilling gaps in mental health services and health services? And I don't know, again, if you've been able to do that level of analysis, but I guess I just worry that if we said the 1.8 million and it was this list alone, that I would worry that there are other worthy needs out there that aren't being met.
Yeah.
Thank you, Chair Redmond. I guess wondering where to start. I think the first thing I'd like to say is that should council go down a path where they direct staff to add a quantum to the existing budget, I assure you that that is not taken by staff as a fait accompli that those funds will be allocated to these specific projects. These are public funds. We have a duty of trust and care with these resources. So there would be no, I would like to ensure that there would be no process that gets cornered or cut in terms of the work that we do with all of our partners to evaluate the work and work together to develop plans and proposals. The second thing I would add to that is, yes, any conversation with all of our partners does and must continue to include conversations around accountability on outcomes as it relates to the continuum and the housing first approach, to ensure that as a system we are working to find and support people through the transitions from unsheltered chronic homelessness to supportive transitional and permanent housing. And I forget what else you asked.
Can I say I find great assurance in that? And if it were indeed 1.8 that this council wanted to add, I know we've had many discussions about bringing the tax rate down, and there'll be a discussion on February 22nd about how we sort of balance those two pieces of the equation. It does trouble me that there is one recipient that's asking for 50% of this. So I'd have to say that jumped out at me right away. And the other thing that I would like to have a conversation about is the fact that this is a system response, and it isn't just geographic distribution, but we can't overlook the fact that there is need in every corner of this region for these kinds of support. So I would hope that that's part of the discussion as we go forward, if we decide to indeed fund some or all of these.
Okay, Councillor Shantz.
Thank you. I'm a little reluctant to vote on this today and to actually give direction. I think there's a lot of unanswered questions about how we do that allocation and what the numbers really mean. But I would ask Mr. Dyer, or maybe Mr. Sweeney.
He's coming back.
Come back. Is there a reserve fund that we could tap into to cover some of these once we get a little more clarity on what is and isn't viable or reasonable?
So through the chair, I think the answer is maybe, and it depends. And going back to the table as I look through it, I would agree with Commissioner Sweeney's description of what we were considering one time versus annualized, right? So is this, is it a discrete amount of money on a one-time basis, or is it something that's going to recur? maybe not indefinitely, maybe for a period of time, but certainly beyond a one-time payment. And so the question of a reserve depends a little bit on, to the extent that amounts being requested are of a one-time or a capital nature, then a reserve becomes possible. For anything that is annualized or recurring, we would say, as we've indicated in the report, that needs to be funded from the property tax levy. There isn't a homelessness, we don't have a homelessness reserve. We do have money in housing capital reserves. To a great extent, that money has become committed over time. So I would say anything you're adding to the budget at this point is more than likely to be funded from the levy. My final comment would be, although the requests total 1.8 million, you shouldn't feel beholden to that number in any way. You could add 500,000 and ask staff to vet and come back with recommendations on how to use that 500,000 or 750,000 or $1 million. Like, the number I think is there for your choosing. That's just what these requests add up to. I hope that's helpful.
Yeah, thank you. And generally, I don't ask for reserve dollars for something that appears to be operating. I just feel like I don't feel confident in the information that I've got here to actually make that direction today.
Councillor Van Beck.
Thank you very much, Chair Erb, and thanks, Mr. Sweeney, for the report. I think this is certainly a challenging issue for us because, as has been noted, we've seen a number of requests come directly to us. We've had other requests come to staff. And we also know that this is an area that, unfortunately, in the short term at least, I think the demands are going to grow based on the economic realities that we're seeing play out, not just in our community, but quite frankly, across the province, across the country, and around the world. In my mind, we're going to need this amount. I'm not sure that these are the exact places that we're going to need to put it in. And I think that's where, staff is going to need to do some additional work. And so, part of the question becomes, as we look to deal with this and recognize that, we're going to be 2 months in already into the year when we deal with this, there's a portion of this that perhaps needs to be dealt with in terms of this year, and then becomes annualized and has the first hit on the 2024 budget. But I do think it needs to come around with some framework. So one of the things, myself and others have talked about in the past is when we have partners who deliver these services in neighborhoods, we've had a model that has had an expectation to manage the situation primarily exclusively on their property. I think what we've come to realize through our experience is that these residential accommodations have impacts on the surrounding neighborhood. And so there needs to be something within our financial arrangements with these organizations to recognize that and support that, because we can't expect them to deliver that for free. But I also don't think that we can just sort of say, well, okay, for this one, it's this much. Like, there needs to be some sort of structure built around it. And so, I would be inclined to really see us focus this in three parts. One, what's the right amount for 2023? Recognizing that it's going to be annualized for 2024. And there'll probably be a whole lot of new stuff that'll develop over the next year. Maybe we'll get some provincial federal money, maybe we won't. And we'll just need to adjust when it comes to the 2024 budget. But I do think some of these things are critical, and I'm not going to make pass judgment on this list that's here before us right now. I think there are some who just right away I would I think, yeah, like absolutely this needs to happen. Others I really am going to rely on staff's expertise to give us some guidance on that.
Okay, Councillor Deutschman, this is your second question. I just want to check, are there any other councillors that have a question that haven't had it for, okay, Councillor Deutschman?
Thank you, Chair. I just wanted to check again, like I know Councillor Harris, as Chair of Finance, had sent out a request to us to say, if there's something you want to propose for budget, please send it in to us, and that was a while ago. And at that time, after I'd met with One Roof, I had sent in the request about the, well, it's described as security staff, but there was that issue, so I sent that in. And I know, I believe the porch light one is from Councillor Wolf, who sent us an email about that. So I'm just trying to wonder, I'm just wondering, I know One Roof, for example, had talked about this Cambridge concept, but was this a recent request, or are these requests that have been received over time? I'm not quite clear on that point.
So to clarify, I don't have the exact start date, but I would say I believe these are requests that would have started rolling in perhaps mid-year. I'll look Ryan and Kelly in, but mid-year of 2022.
Right. Okay.
You know, I'll leave it to my colleague, Mr. Dyer, to talk about the any specific questions around that other process. But yes, these were not all end-of-year requests.
Right.
Yeah.
So mid-year. So you know, if you're looking for direction, I would say two of those. If the two from One Roof, the first one and the third one, were like mid-year, they weren't necessarily submitted as part of this budget process. And I would say you could probably take them off, and then we would consider them later on. Or if they're desperately needed, then leave them in. But I didn't see that as them making a request for $5, $6, $7, $8, $900,000 in this budget process. When in my conversations with Sandy Dietrich-Ball, it was the issue of the security. I appreciate the importance of the Cambridge youth issue and the other, but I don't know if those were specifically part of this budget process request. Okay, that's the issue that I'm having here, is a little bit of, if you're looking for direction, I'm just trying to help you out because you're asking.
Can I just, yeah, so I think I appreciate that.
Whoops.
Just also for context, shortly before Christmas, as we just really started to get into the budget process, staff made me aware, basically they said, we have a number of requests that are coming in and have come in. And my direction to staff at that time was, given, if you recall, the number we had floated out publicly on the levy was, I think, 15% Craig, something like that. And so my direction to staff at that time was, at the moment, we have to tell everybody to pause, that we don't believe there'll be any additional funding, and we have to wait to the budget process to roll out. So this is just, again, I want to just reiterate that from a staff perspective, from my perspective, it was really, really important to bring a level of transparency and equity into this process, which I will also, even this process leaves me feeling a little unsure, because there would also potentially be organizations out there that didn't come with something this past year and might be sitting in a place to say, oh, I wonder if that has put us at a disadvantage. So we're just trying to catch up. We do have a very strong relationship with all of our providers. There's never enough money, and we always try to live within the pocket that council awards to us.
So, Chair, yeah, on that. So just following up on that, because again, you're right. I mean, other people, other groups wouldn't have thought to maybe submit something throughout the year, as you've picked up on some of these, like, for example, One Roof. I would say anything that's been submitted specifically for this budget process should be considered. And leave it at that. That's sort of my thought.
Mr. Lochner?
Yeah, so maybe to expand on what Peter said, we deal with this as sectors. We deal with the childcare sector. We deal with this group as a sector. And as we communicate back and forth, we talk to all our sectors as, if there are issues in the sectors in terms of funding, we'll bring that to council through the 2023 budget process as an example. So that's what Peter and team did. The question then becomes, and the sector's asking this, wait, is council considering this as a whole, which is the report we've brought forward, or is council going to consider this only if we delegate? And so whether we're talking about the childcare sector, the grants and organizations, the approach we've taken in the past and direction from council is to bring that forward as a sector. So our advice is, to stick to that sector response. If we do go to the technicality, I guess, or maybe not technicality, the process of delegation, that's fine too. But then we would get a lot of delegations, and that would break from the practice of looking at things as a sector. Again, childcare sector, shelter sector, homelessness sector, and so on. Grants, yeah. So our recommendation would be to look at this as full information, and I think to different councillors' points, if you want to take some of these ahead of others, we're looking for that kind of direction.
Councillor Sullivan.
Thank you, through you, Chair. Just looking over this report, I am going to be in favor of deferring the motion to discuss this on February 22nd. But in terms of direction in general, it sounds like from some of the discussion, maybe going forward, so not this budget process, but once we start the new one in March, I believe it probably starts, that we look at formalizing a process. A lot of this, there seems to be some equity issues on groups just arbitrarily coming and asking for funding and not like asking councillors in some cases, going to staff and other not knowing if they're asking for our upcoming budget. Could we look at staff looking at how to formalize a process, whether that be like what CAO Lochner was talking about in terms of delegation or not, but if we could look at something like that for direction after this budget to help improve going forward.
Most certainly through your chair. That typically is our process, where we would be bringing in a non-election year, say in September, Peter would come forward with, here's what we're looking at in terms of this sector. Here's what we're looking at in terms of grants. Here's what we're looking at in this. So this has been bumpy, obviously, with the election year, but most certainly that's the way we have to move forward.
Councillor Foxton.
Thank you, and through you, Chair. I'm leaning towards what Councillor Deutschman was saying. If these have been submitted throughout the year, we don't even know if they're still valid. We don't know what's happened. We don't know what grants have been given to these individuals, and some of them may not even exist anymore. I believe a budget process, and you know what? In our township, everybody knows when budget is. Everybody knows when they have to apply. So I think that we should basically look at what was brought forward by councillors or the budgets, because councillors were approached by people during the budget phase, or individual groups coming to council or writing to council at budget time. But if this is throughout the year of 2022 for the budget of 2023, I'd need an update on each of these groups and whether they've achieved what they wanted. Like I said to the Philharmonic Orchestra, there's $2.8 million in grant money out there right now that United Way and the Community Foundation is begging people to apply for. So I'm leaning towards Councillor Deutschman and what he said.
Just for a point of clarification on behalf of the chair and for committee, none of these requests, I don't think, came specifically for budget this year.
The full list did not go through a formal budget consultation that's related to bringing these forward to council. This really, some may have through either a delegation, the specific request, for example, the delegate today would be part of that, but I can't say it's an exhaustive list that all came through some formal budget process.
Councillor Deutschman.
Okay, so thank you, Mr. Chair. Just for my clarification then, when Councillor Harris, as Chair of Finance, asks for submissions for budget purposes, and I sent in a specific request on behalf of one roof, that was a specific request for this budget. So I don't know if that meets your definition of what you just said, because to me that does. That's a specific request. I'm just commenting Councillor Erb's comment that none of these were specifically sent in for budget, but that one was. That's why I was confused about the other two from One Roof, because, and I asked, when did we get these requests? And I know Councillor Wolf specifically sent us an email recently indicating she was going to bring forward the porch light proposal, which I see here. And we know from Better Tent City that they specifically made the request for 180. With respect to the rest, I don't know when they came in. And that's why I asked, were they specific to budget? And if they're not, I mean, if you're looking for guidance, I don't see how we can include them in budget if they didn't come. And that might be this year, but as suggested by Councillor Sullivan, let's get a process in place so that people better understand what to do during the course of the year.
I wasn't aware of the timing when you had talked to One Roof to encourage them to come in. So you may, I'm not arguing that. I was asking for clarification.
I sent in a written submission.
I don't remember the date.
It was, I'm just letting you know, it's after Councillor Harris asked for submission.
Good. Okay. Councillor Wolf.
Through you, Chair. Councillor Craig and I went to One Roof recently, and they requested that we ask for the Cambridge thing. But at the same time, I would like staff not necessarily to go by this list, even though I'm on it, but to use their judgment, because they've had requests from many organizations throughout the year. And I think obviously we need more money in this budget, so that's 1.8 million. And I'm not saying that One Roof should get 50%. I'm saying that staff should look at the needs of the community, and now we're giving them a bit more money to meet those needs and to vet the organizations and just see where they think region-wide, that some of this money should go and then bring it back to us. But I would hate that somebody doesn't get funding just because they didn't have a councillor put something in for them. And frankly, like this last week or so, I've been approached by several organizations, and every organization I go to seems worthy. So I'm sure staff has a difficult problem, but I do believe that we need to increase this budget line, which is, whether it's 1.8 million, whatever it is, to try to meet the needs of the community.
Okay, Mr. Sweeney wants to respond, and then I have two other speakers, and then I'd like to see if we can find some consensus of how we want to deal with this.
Thank you, Councillor. I know the budget book, you have access to the budget book. Just to provide a bit of context, the funding envelope that we utilize for housing stability, homelessness programs is approximately $40 million. It's about 1/3 of our overall housing and homelessness budget. That budget has been significantly impacted by the reduction in SSRF funding. It has been offset somewhat by a 2-year magic thing that my friends in finance did in terms of adjusting for that. And what we did going into this budget is put our staff and our conversations with our partners into that budget to respond to the challenges of chronic homelessness as best we could, while also doing our best to maintain some level of fiscal prudence given the current environment and some of the signaling and feedback that we were receiving from council throughout. So I want to make sure that everybody does appreciate that we have ongoing robust conversations with our partner in this space. And yes, with the current crisis, there's never enough resources to go fully around. And so we try to do our best to work with our partners to stretch that as best we can and apply those to the most priority projects and programs that we have.
Thank you. Councillor Foxon.
Thank you, Chair. This is tough because on one hand, we're talking about a huge increase in taxes this year, 9.2. And we've spent numerous times increasing. Some councillors want to cut it down. We have to be really logical here. And so we've got this huge list now of 1.8 million, and there's probably still more things to come. And again, I need to know what's valid and what's not. If this has come out through the year And I know there's been tons of grants given out. I don't know which of these asks are even realistic. And so I'm not going to say put 1.8 million aside because I don't even know what's real. And as Chair Redmond said, one of them wants half the amount, which means that they realized that there may be a chance to grab money. And when we got an opportunity to grab money, you do. But do you really need it? And are we giving this to areas where we're leaving other people homeless? We have to be smart. We have to really look at this situation with eyes wide open and decide what we really want to achieve as a council. We cannot take care of every single whim. And I'm sorry, but if you tell me that you're going to give me money, I'm going to find a reason to spend it. But I would really like us to think long and hard on this and remember the goal of this council really was, in a lot of ways, to deal with homelessness. And that's a big ticket. Thank you.
Just want to check for quorum here. We're okay? Okay. Councillor Shantz.
Yeah, thank you. Similar to Councillor Foxton's remarks, I would say I'm still struggling with what to do with this. On the one hand, we know we've got a big problem here that we have to deal with. There's already an increase of 9.4 million in the budget. If some of these requests are not really current, then I have trouble certainly granting the 1.8 million, but I don't know what the numbers should be. So I'm struggling, and I guess we've postponed other requests to put it in the context of the full budget when we come back on the 22nd, and that would probably be the way I'm leaning, is to give you some time to maybe give us a little more information and pull some of these figures together.
Mr. Sweeney?
Yeah, just to be clear, we're not asking for, just so everybody's clear, we're not asking for a grant of $1.8 million that would automatically flow. We have a number of requests in front of us that are over and above what is currently in the budget. We wanted to provide a process that was, all things being equal, as equitable and transparent to all organizations. Councillor Fox and I cannot give you the validity of one versus another here today, and I can't give you that before February 22nd, so I don't want to make a commitment that I can't meet. So, the alternative is to allow us to continue to do our work and have conversations with all of our partners. But anything that comes out of it that would not fit into the 2023 budget that eventually gets passed by this council would have to be dealt with in some other way.
Is your hand up again, Councillor Wolf? No. Councillor Van Beek?
Thanks, Chair. But I guess in the interest of trying to move something forward, and I think, in fairness to staff, I think they're also trying to create a starting point for us for budget day where we can add or subtract as things move along. But so that at least we understand what that starting point potentially is. So in that spirit, I'm going to suggest that we notionally for budget day allocate the 1.8, but with 1.2 being applying this year and the rest analyzed for next year, but referring the whole discussion around it to budget day. So there's no final decisions being made today, but simply as Mr. Dyer starts his presentation, that 1.2 is built in, and we can pull it out. We can add to it. We can do what we want, but at least it's a starting point for that day. So that's what I'm suggesting. But it's simply a number, but referring the whole thing to the 22nd.
Oh, okay. Councillor Craig is next.
Sorry, but yeah, Councillor, I'm just cognizant of the fact, as I look at this list, there are things that are arguably necessary so that we don't see a reduction in services that already exist. And I'll give, quite frankly, an example. A Betterton City has been doing our work for us for the last couple of years through community donations. That one, in my mind, and I don't like using the word no-brainer, but I will, is a no-brainer to me. There are others that are more complex. Some are really looking at new additions into the system. I'm not arguing that we may or may not need those, but we need a more fulsome process around additional things. But my first focus is on ensuring that the ones that we have can move forward. And I will say, in terms of One Roof, quite frankly, where is that money best invested? The concern is being expressed as coming as a result of the secondary shelter that's moved into the neighborhood. Are the additional dollars needed at that secondary shelter or at one? That's work that I need staff to evaluate and give a recommendation on.
Councillor Craig.
Well, I don't want this to become contentious, but I sent in a memo to council and to Chair Redmond with regards to my overall feelings about things we didn't have in Cambridge. Now, at the point I wrote it, we only had one outreach worker, and I was asking that we have two. We don't have a women's shelter. We don't have a youth shelter. And I talked about the fact that there were no detox beds. And I'm wondering, is tomorrow, are some of these issues going to be bubbling up to respond to what I've written? Am I going to hear from staff? Or do I just start putting motions in? I mean, I need some direction on this. If everybody else is confused, I'm confused too. Because, you know, we can talk about what we already have. But I want to say with One Roof, you know, how impressed I was with what they're doing. There's no question about that. And all these agencies need our help. And I guess, but anyways, but Cambridge doesn't have these things. All right, and we need to get some answers about where this is going.
Mr. Lochner?
Yeah, thank you. To Councillor Craig's question, I think it applies to other questions and comments that were made around the table. Our best advice is to make a decision on an envelope, and is that an increase or not? And if it's an increase, some sort of envelope, because staff need to take that away if we get an envelope, an additional envelope, and look at all the needs as you described. So whether it's women's health, whether it's security, whether it's, you know, someone delegated or not, we know in talking to our system partners that they're saying, hang on, there's a need. And many of them are saying, if the way to get money is to delegate, then we'll come delegate. And we'll have more people here next week delegating if that's where we go. So my advice would be to have the discussion on the more macro issue of, is council willing and is a priority to add additional funding to this year's budget, and then direct staff to go away in short order to look at all of these issues and all of the various motions and letters and comments that we've had made. I think it would be a mistake tonight or even in a couple of weeks, to just deal with one of those, because we have dozens of requests, whether they're in the form of letters or motions or delegations. And we struggled with this. Our starting point as staff was, the direction from council was, that tax rate number is pretty high. So go back and be very diligent in the decisions going forward. We acknowledge that this is a partial list. 1.8 million is just the requests we know of, either that came in through councillors or through Peter's team in the fall. But there are many more. So I think if we were to have a discussion on policy or priority, it's very similar to that discussion we had a couple of years ago on affordable housing is our biggest priority. Well, we didn't have much in the budget, and we picked $10 million. That was out of the air. We picked 500 units a year. It could have been 1,000, it could have been 200. I'm hearing tonight, I think every member of council is looking at these situations and saying, this is very, very, very important to this community. It's hard for you to judge which is more important. It's hard for us as staff to judge which is more important. If we had additional funding, recognizing that that is going to impact the tax levy of X million dollars, we would be able to come back knowing that and give you a recommendation. Again, it would be council's decision in, say, March or April, a recommendation on how to fund these things. We could look at things, as Councillor Babanovic suggested, from what's the most urgent and emergency, what's new priorities, and as Councillor Craig suggested as an example, where do we have gaps in inequity in terms of access to care? But that would take a couple of months to get through. I think that's the better route to go. I think we get a stronger result, but that would require additional funding. And I think that's the biggest decision in front of council today. Are we adding any funding or not? Because option one is, don't add funding, stepping away from the specifics of this. Option two is adding some sort of funding. And whether that's one-offs or whether that's several $1 million, our preference as staff would be, the larger amount so that we can deal with as many issues as possible and come back with a recommendation on as many issues as possible.
There are 4 speakers, and I'm just wondering, to try and help us focus and maybe come to a decision, if staff could put up on the monitor one of the motions that they had drafted to try and help us come to it.
Jim, it's all right. I believe Councillor Babanovic and myself are going to first and second motion number 2.
Okay, so I think that's the one that we were going to put up on the screen. Do you want to, can you put that up?
Mr. Chair, I have a question for staff, if I may.
Okay. So if we're going to take more questions, then Councillor Craig, or no, you were next, sorry. Go ahead.
Well, thank you. And I'm trying to say this in a gentle way. But if we were to add $2 million more to this particular discussion we're having, surely staff within the budget can find $2 million of savings. I mean, we're not talking 1%, right? I mean, if we directed you to go back, I mean, we're talking what, 1/3 of 1%? And say, go find it, and then come back to us with that money to add to this, which is a priority. And, and I have to speak for Cambridge about what's happening. And I've talked about the deficit in the issues we have down here, and I think we need to address these.
Great.
That's all I'm asking, Mr. Chair. Can we do it?
Mr. Dyer?
Of course I can do it.
Through the chair, we're obviously, we're in council's hands. If that's the direction we're given from council, then we will we'll take that as direction and report back. I think, what staff would say is since we started this process many months ago, I think it's very fair to say that the number that is before council right now is already significantly below where we were several months ago. The level of reductions that have already been, I would say, built into the base budget is significant. I can't recall the exact number, but I believe it's in the range of $9 million that have already come out of the budget. And that's on top of even more significant numbers that came out in 2021 and in the 2022 budgets as well. So if the suggestion is, or the belief is that finding $2 million to offset an increase of $2 million is going to be easy and would not involve service level reductions, I don't think that's correct. I think the reductions that would be brought forward would not be of an administrative efficiency nature, but would be of a service delivery and service level nature. So I think that's going to be a very challenging approach to take if the expectation is there'll be an easy $2 million offset. That will absolutely not be the case.
I think we have Councillor Fox, and you want to put a motion on the floor, is that correct? I'm sorry?
May I speak before, because it may alter what the motion is?
Go ahead.
Thank you. So, I mean, I recognize that this is a really difficult budget for everyone, and I think we keep on looking at everything in silos, even our transit discussion on looking at pilot programs, and it's not that these aren't great things, but we need to remember that we at council level need to set priorities. I would ask that the recommendation come back to us, so I'm fine with the deferral, but I would ask that it would include a recommendation to speaking to these in relation to our housing and homelessness master plan and how spending this money would help us actually achieve our long-term goals. Again, not to say that I don't want to give money to everyone who comes to us, and everyone does have valid reasons for needing it, but we as a council need to be deciding how decisions we make now about funding long-term are helping us reach our goals as a whole region. So I would ask whatever motion gets brought forward tonight that it asks staff to relate back how that funding envelope, whether we approve it or not, how it would impact our overarching master plan for housing and homelessness.
Mr. Sweeney?
Councillor Salinan, thank you very much for that. I will take us back to a budget conversation 1 or 2 times ago. I don't remember when I was talking about, on behalf of staff, the priority work for 2023 is indeed what you just said. So back in August, in addition to the previous council giving us support and direction to implement the interim housing plan, it was also to launch a process to develop a plan to end chronic homelessness that is a companion to our 10-year plan on affordable housing. And so that work is just kicking off. It is intended to be an all of community response. It is intended to be a plan that is developed in and with the community. And our preference and our goal is to tie all of our work and root all of it in both of those plans. I cannot give you tonight specifics about how one or all of these are tied directly to that. That is really the work of the housing staff for 2023 and the work of the community in 2023. I hope that helps.
Yes, it does. Thank you.
Councillor Foxon?
The reason I'm not going to wait for the master plan for this is because of a better tent city. They came here, they've asked, they've done an amazing job on our behalf, and that's the reason why I'd asked for the deferral. And then you can, we can try and pull out what we think is essential to pull out on the 22nd, and then refer the rest to the housing plan, if that's okay. So I would like to still go with the motion for deferral, please.
A motion for deferral?
Yes, please.
Okay. If I get a seconder, then we have to have a conversation.
Yeah, we need a seconder before we debate.
Is there a seconder for that? And I want to make sure we don't get into the procedural issue that we got in just before that. On a motion of deferral, anything further that would happen would have to be direction to council, that we wouldn't be dealing with any motions.
Well, what about my motion?
Are we clear on that? Okay, so we have a motion to defer. Is there a seconder?
No.
Seconded by Councillor James? Okay. Pardon? I'm sorry? Okay, so we don't have any.
Excuse me. How did this motion get?
Okay.
Excuse me. Sorry. We had other motions before this one went up. I made a motion when I said I want option B for 1.8. You made a motion, and he thought that Sue had.
We never had a formal mover or a seconder on any of those to my, unless.
Not on mine, no.
Respectfully, Mr. Chair, I did put quantified a motion with numbers, referred it to budget day. Councillor Foxon at the time indicated she was prepared to second it. And then there was a whole pile of other dialogue that went on after that. I'll leave it up to the clerk to advise you accordingly.
Take a 5-minute break.
And for mine, sorry, I
break.
said I wanted option B, 1.8 million, and we said we would let other people speak before we would bring it back.
Okay, with committee's permission, we're going to take a 5-minute break. And Thank you for your patience. So just for clarification, what we have on the floor is a motion of deferral that was moved by Councillor Foxton and seconded by Councillor James. That takes precedence over any other motions that were made before that. If we were to vote on the motion to defer and it was defeated, we then could consider other motions. If we vote on the motion to defer and it's approved, then we could only be taking direction from committee. Do I have that correct, clerks? Okay. So what we have now on the floor is a motion of deferral, and I'm going to ask for council to vote on that deferral motion. Using your buttons.
Mr. Chair, just point of clarification, couldn't Councillor Foxton rescind or just take it off the table,
I
her
can take
motion
it
to
off the
defer?
table. I'll take it off the table.
It doesn't exist.
Okay, that would, I understand, would have to, council would, or committee would have to agree with that?
No, she can just
Nope.
say it.
You just take it off, withdraw it?
She withdraws it.
Okay, okay. Okay, well then can, okay, go ahead, Councillor Vandenbeck.
Thank you. So I think the clerk has suggested wording on the screen, and it goes back to the one that I originally suggested and Councillor Foxton was prepared to second, which was that we take 1.8, of which 1.2 would be annualized in 2023 and the remainder annualized in 2024, and refer that amount to final budget day on February 22nd. And just to put some context into it, and in a conversation with Councillor James, I think it might be helpful. Folks, particularly those who are new, may not fully be aware, is over the last couple of years, as this issue bubbled up in the community, we obviously needed to respond to it, and we responded to it through various mechanisms. Regional dollars, some provincial dollars we were able to get, some COVID dollars that we were able to get, and some capital dollars that we were able to get from partners. We're now getting to a point where this is for the time being, become normalized in terms of what we need to do. There's some holes that still need to be plugged. And then, quite frankly, there's some new components that we still are going to have to deal with that I know folks like Councillor Craig and others feel very strong about that we're going to need to deal with. But we have to put some kind of structure and process in place for that. This will potentially, and ultimately the final discussion will happen on the 22nd, but this will allow us to start that process this year and continue it into 2024. And obviously there will be additional work that's going to come out of the overall master plan that Mr. Sweeney and his team are working on.
So, thank you. Okay, so it's been moved by Councillor Vandenbeck. Is there a seconder? Councillor Foxton seconded. Okay. I have one speaker, Councillor Deutschmann.
Yeah, thank you. I support the motion. I just want to make sure that the way it's worded correctly conveys the intent, which is 1.2 will be spent possibly in 2023, and then 1.8 is the annualized amount in 2024. And I just see the word remainder to be implemented in 2024, so I just wasn't sure. That's my understanding. Maybe I have it wrong. I just wanted clarification.
Mm-hmm. You want to respond to that, Councillor Vandenbeck?
Well, sorry, I'm not sure if I heard it correctly, but it's 1.8 total. 1.2 will impact the 2023 budget, right, and the other 600 will be added in. So it's the first hit on the 2024 budget. So come 2024, it'll be 1.8 annualized.
Right, and that's what I'm saying when it just says the remainder to be implemented in 2024. I think it should specifically say that 1.8 would be the annualized amount in 2024. I just wanted to make sure it was doing what you intended it to do. That's all.
Yep, you're comfortable with the word. Okay. Mr. Dyer.
Thank you. Through the chair, just a point of clarification. The 1.8 million in the second line, we're saying that the region amend the preliminary 2023 homelessness budget. I think we're amending it by 1.2 million, not 1.8. For 2023. So that first line says we're amending the preliminary, we should be very specific on, committee should be very specific on the amount that you're amending the 2023 budget by. Not a grammatically correct sentence.
Do you want to confirm that, Councillor?
If I understand it, it's 1.2 million. The intent is 1.2 million in 2023 and then 1.8 million thereafter.
That's exactly right. So however you and clerks need that to read so that everybody understands that afterwards is good for me.
That's better. Thank you.
And are we okay to vote on it the way it's written, or do we want to, do you want?
It's changed.
Mr. Chair, instead of saying the remainder be implemented in 2024, it should say 1.8 million implemented in 2024, so it's clear.
Everybody happy with that?
Okay.
Okay.
Yeah, there you go.
Okay?
Yep, thank you.
Call the question. All those in favor? The system's a little slow here. It's getting tired. Okay, let's vote by hands. All those in favor? Contrary? Carried. Oh, it's carried. Carried. Mm-hmm, mm-hmm. Okay, that was easy. Now, we have we're on to the consent agenda, and we have Grace Birmingham and Krista Barber here to speak to the public health, the dental health program, and we also have representatives here from paramedics to speak on item 7.1, and you've all been waiting for quite a while. The dental issue is on the consent agenda, so I'm wondering, does anyone have any questions on that, or Dr. Wong, do you want to speak to that? Grace or Krista, do you want to respond in any way? I feel badly seeing that you came in here about 3:30, 4 o'clock, and here we are, and it's consent, and we may not even have any conversation. Okay, we'll move on. Well, I need a motion to approve the consent agenda. Moved by Councillor Shawn, seconded by Councillor Wolf. All those in favor? Contrary? Carried. Thank you. Enjoy your dinner. Thank you. All right, back to the regular agenda item now, 7.1, the alternate destination for the paramedic services. Dr. Wong, you want to introduce that to us, please?
Yes, please. Thank you, Chair Erb. Good afternoon, Council. I am very pleased to introduce to you John Riches, our new Chief of Paramedic Services. John has a wide breadth of leadership experience across all core areas of paramedic services. He has also served in leadership roles on behalf of municipalities with healthcare partners and Ontario Health teams. I am thrilled to be welcoming an effective, collaborative, and strategic leader such as John to our service. I'd also like to take this opportunity to mention that we have changed the name of the Public Health and Emergency Services Department to be Public Health and Paramedic Services. This will ensure that the term paramedic services, which better describes the advanced skills and expertise of our modern service, is displayed clearly in our departmental name. It should also reduce confusion with other emergency responder services. And finally, I'd like to introduce Director Rhonda Nichols, who will be presenting on the Alternative Destinations Report together with Chief Riches. Thank you.
Thank you. Welcome.
Thank you. Through you, the chair. Thank you for having us this evening now. We know it's been a long day, so we'll be brief. But as Dr. Wong indicated, my name is Rhonda Nichols. I'm here with Chief Riches, as well as Deputies Kevin Patendra, James Topham, and Katie McDonald as part of our team. Ann Bettles, who's also part of our team, is at home today. So we wanted to take a little bit of time and share with you what we've been working on in the past couple months to bring forward an application for an alternate destination clinic for mental health and addictions in supporting paramedic services. We all know quite well the need to support our residents with mental health and addiction challenges is growing, particularly as we've come out of the pandemic. We also know that emergency departments are not an ideal spot for residents to be seeking and receiving care for mental health and addictions in certain circumstances. Thanks to legislation changes, there are now more appropriate options for service delivery for paramedic services, and we want to share a few of those opportunities with you here today. I'm going to pass it over to John to talk a little bit about the background and where we've been.
Thank you, Rhonda, and I would just like to say thank you to Council and to you, Mr. Chair, for welcoming me. It's only my 7th workday, I think, so I'll ask that you please be gentle this evening. The challenge with paramedic services right now is that, and if you can go to the next slide, please. The challenge with paramedic services right now is that we have a lot of pressures on us related to offload delays, increasing call volume, changing demographics within the region. And the only option for transporting patients right now is an emergency department. And so that creates pressures because sometimes we're taking people to the emergency department who could get their care elsewhere and better and more appropriate care elsewhere. So that's relevant as well. I would like to acknowledge Dr. Wong, Deputy Chief Patendra and Topham, and Deputy Chief Crossan, who's not here, and all the leadership team for welcoming me this week. It's been an eye-opening experience, and I'm really excited to be here. But also, in particular, Supervisor Ann Bettles of our Community Paramedicine Unit and Katie have done the yeoman's work on this report, and they should be acknowledged for their work. The challenge here is that the province did enable changes in the legislation in 2019 to allow the diversion of select patient cohorts to other options other than just transporting them to hospital. Originally, those cohorts were deemed like palliative care patients who we could treat and then refer to palliative care physicians at home rather than transport them, and that's happening province-wide right now. And then certain other areas of the province got approval for what I'll call alternative destination options, London being one of them, which is in your report today. The challenge here is that we must apply, and I want to make sure Council's very aware of this, we must apply to the province Emergency Health Services branch to get approval to transport to a location other than an emergency department. So the proposal before you today and the report before you today is not a fait accompli that suddenly we can transport tomorrow to an alternative clinic. In fact, in the region of Waterloo, there isn't an alternative clinic right now. So the work that Rhonda and her team and Kevin and our team did on this report is to set the ground for having these discussions and trying to figure out how do we best support our acute care and primary care community in setting up a clinic that then we can get approval from the province to transport to. So I want to make sure that that's very clear because it's different branches of the province and that's relevant. One of the good things though is there are secondary benefits to things like alternative clinics. First one is it's about getting the patient to the right care at the right place at the right time from the right provider. And that's really critically important for those patients that are suffering from mental health and addictions type concerns. The secondary benefit may be that if we can defer patients away from an emergency department, that will help the emergency department with their patient flow issues, and it will also help paramedic services with offload delays and other challenges like that. To give an example, in 2022 for paramedic services in the region of Waterloo, 10% of our 911 calls were for patients who suffered from mental health or an addictions concern. For those of you who don't like percentages and want numbers, we did about 57,000 patient responses last year, and 5,600 of those, so about 10%, were patients who suffered from a mental health or an addictions concern as their primary chief complaint. That's what we call in our business. 75% of those patients, of those 5,600, were transported to hospital. So what we're talking about is that 75% of 5,600 is diverting as many of them away from an emerge to a safe alternative clinic. So I want to make sure council understands what the intent here is. Will it on its own solve offload delays? Because I know that that is a concern of council. No, on its own it will not solve, but it's like peeling a layer of the onion, and eventually you start peeling it back and you get some help. There are other things we need to do with offload delays, and I'm sure I'll be before council discussing that in committee days to come. The other thing that we want to make sure is very clear is that you understand that this is not a clinic that public health or paramedic services will be operating or is responsible to operate. The legislative mandate for this clearly falls under the provincial legislation for acute or primary care. What the report's intent is to set the groundwork to have conversations with our partners, with the community at large, to help establish a co-design that can create and help support getting provincial funding to create a clinic that patients can go to either by their own means or by us, but they can get the help they need. And it will also set up an alternative destination for us to transport patients under this criteria. So I wanted to make sure that was clear to council. Next slide, please. Do you want to start on this part?
Sure.
Thank you.
I'll give it a go. So this visual, albeit a little bit challenging to see on screen there, is really meant to help you understand where the position of this would be within the broader 911 crisis service continuum. So you'll see on the right-hand side, it refers to Waterloo Regional Police Services, and by no means are we here to speak about that. I know you've heard a lot about the service models that they have in operation in recent days, one of them being the impact model, and the other one being the crisis call diversion clinic that they've, the crisis call diversion program that they've recently launched. This is really to illustrate that as we support the system and community to build different models to support our residents, they need to be connected through strong service referral pathways, and they all interact with each other. And so I'm going to let John talk a little bit more about the paramedic side, but the intent is really to help you start to visualize all of the different service models that are in play right now and that could be in play in the future, and how we must connect them and align them so that patients are caught in the system and remain supported by the system and not falling through those cracks.
Thanks, Rhonda. One of the challenges with paramedic services is that, as I mentioned earlier, the only options for us was either until 2019 was either a patient refused to transport to the hospital, it's what we called a patient-initiated refusal, or we transported them to hospital, and it had to be a hospital that had the big blue H on it with an emergency department. There wasn't another option for a 911 response. So what you'll see on the left side of the screen, and again, I appreciate that some of the colors aren't there, so it's a bit harder to read the bullets, is the traditional 911 outcome for a transport was transport to a hospital. What we're hoping this idea will bear fruit on is creating this alternative destination clinic for this specific patient cohort. The time will tell what patients will qualify and meet the criteria for this alternative destination, because you'll want to make sure, and we will want to make sure, that these patients are safe to be transported to an alternative clinic. They don't have another complex need related to some other medical complexity that means they need to be in an acute care hospital. But those are all things that the design process will work out. The next slide, please. a lot of our report focused on the alternative destination clinic that London Middlesex, our friends in London Middlesex did, and they were kind of the groundbreakers in this a few years ago. Originally, their clinic was built in or created in the London Health Sciences Centre. What that meant was paramedics were transporting to hospital anyways, and when they walked into the doors to the emerge, they either went left to the emerge or right to the clinic. So it was very simple and easy to do. Since that time, the clinic has now been moved out of the hospital and is now in a community setting. And I'm a big believer, as is my team, about stealing good ideas from other regions that work. And so this is a good starting point for us. London has been really good with Supervisor Bettles and Deputy Chief Pretendra and sharing their wins. And some of the wins you'll see on the slide here. One of the things they found is that of the mental health patients they transported, the ones that met the criteria to go to an alternative destination, they were able to divert 50% of those to that clinic instead of going to the emerge. So when you see numbers like 50%, I don't, as much as I would like to see that's going to reduce offload delay by 50%, it's not. It's 50% of the 10% of the call volume is what's expected. So it's a bit more nuanced than that. The other thing we're really aware of is, and you may have heard of this in the press, in Toronto with Unity Health Network, which is St. Joe's and St. Mike's, they opened up a clinic over the Christmas break called the Stabilization and Connection Site that was specific for the homeless, who a 911 response was generated for, who were suffering from alcohol intoxication only, and they diverted them to that clinic that had on-site support. So there's other things like this going on in the province. And what it highlights is the need to establish, and Rhonda and I and our teams, this will be our focus, is to establish strong connections with the hospitals and our acute and primary care partners, because really we need them to help drive this bus, and our goal is to help set the framework for them. So hopefully that answers some of your questions. You may or may not have more questions. I'm not really sure. I don't know, Rhonda, do you have anything else to add?
I'll just walk through the last slide then, Julie, if that's okay. And this is partially complete for some reason. I apologize. I'm not sure why the last two bullet points haven't populated there, but this is really just to give you an idea of a high-level timeline and some key milestones that we anticipate in the near future. So key partner validation happened in January. We hosted quite a robust community consultation with a few key partners that currently interact with our paramedic services. So a few community mental health and addiction service providers, hospitals, Ontario Health Teams, Ontario Health, Waterloo Region Police Services, as well as paramedic services were there. London Middlesex Paramedic Services were kind enough to present on their model in detail and shared some of the outcomes. At the end of that consultation, a unanimous vote was had to move forward with a plan to implement something like the London Middlesex model in Waterloo Region. What that might look like yet, we don't know. Our next step is to form a community-based steering committee that will guide and drive forward the next pieces of work. As Chief Rich has indicated, approvals from Emergency Health Services branch will be first on our list, followed by a fulsome care plan application for the province for funding for this model of care. Beyond that, we plan to leverage the Community Safety Wellbeing Plan and firmly ground community engagement and co-design using an equity, diversion, and inclusion lens, and certainly through a patient experience lens as well. So including and engaging persons with lived and living expertise and experience will be important as we move forward in the community co-design towards what this could look like in the region of Waterloo. So thank you for your time. We are all happy to take any questions or comments you may have.
Thank you for your presentation. Councillor Craig.
Thank you, Mr. Chair. Through you, just a quick couple of questions. The response that you have for, say, an overdose, does that still involve police, fire, and other units?
Through you, Mr. Chair, that's really dependent on the type of overdose it is and any other contributing factors to the call. Most overdoses are very complex. It's usually not just someone's overdosed on a drug. There may be something else that's involved in that situation. So usually overdoses start with a tiered response, which means police and fire sometimes do come, but it's not always like that. It'll depend on the assessments made by the 911 PSAP and also by the ambulance dispatchers at Cambridge CAC.
No, I was thinking more, I understand what you're saying, but, you know, in terms of freeing up some of the other services, can you not just have paramedics go for an overdose, which is a complex assessment?
Yeah, in certain situations we can. The challenges with some overdose calls, as I'm sure committee appreciates, there is sometimes a first responder safety issue. And so sometimes often what you'll see is a dual response between us and police for first responder safety. But if your question is more about the right response and an efficient response, certainly things like tiered response is something we're looking at to try and address getting efficient resources to the right call at the right time.
Okay. And my second question, do you still keep stats on the response times in the different municipalities and townships?
Through you, Mr. Chair, yes, we do. And in fact, I believe at the April committee meeting, we'll be presenting on our 2022 real-time performance plan. So you'll be getting those statistics then.
Yeah, I'd like to see that. Thank you very much, sir.
You're welcome. Thank you.
Councillor McCabe.
Thank you, through you, Chair, and thank you for the presentation to everyone involved with it. It's really helpful. Just wondered what the screen, or the slide, I mean, that had where the 911 call comes in, and then if they're mental health calls, then you have about 5,600 a year. And the police were here last week and said they have about, well, I think they're not really quite sure, but they had something around 3,000 or 3,200. Probably a low number, I would suspect, given the volume of calls they had. But how does it determine who goes to what? Because I mean, collectively, that's a lot of calls when you add those together. And so on the other, one part of your slide, you had that the police and then CMHA have a portion of work that I do too. So I'm just wondering, eventually, will the police and that side of it come to this alternative clinic, or how does that flow work?
Through you, Mr. Chair, there's a couple of questions in there that I'll try and answer for you. One is I might suggest, and I can talk to Dr. Wong about this, I might suggest that we do a presentation to committee about how 911 response works for all committee, not just mental health and addictions. I think that would help council. But generally speaking, all calls come into the 911 public safety answering point, which Waterloo Police run for the region. That's where the dispatcher or call taker first says police, fire, ambulance. And for those of you who've called 911, you're probably used to that. And if someone says an ambulance, the call will get diverted to the Cambridge CAC. And sometimes the 911 dispatcher will also listen in just to double check that there aren't any safety issues. So it depends on how that initial call comes in and what the 911 center does with it. I would say to you that of the 5,600 we did in 2022 and the number that Chief Crowell gave you last week, I would say a lot of them are what I would call duplicates, meaning we're both counting the same call in our statistics because we both responded. Not all of them will be. The challenge with mental health specifically is that the only body that's allowed to detain somebody under the Mental Health Act is a police agency. So the police can't do that. Or the police do that, we cannot. So often where we get involved, and when the police aren't involved, is if someone is calling voluntarily for themselves, they need crisis support, those types of things. The police may not respond to those if there is no risk to the person or to others. The police have a duty under the Mental Health Act to detain someone for safety reasons, either for themselves or others. How it connects to, I'll take a stab at this and then maybe defer to Director Nichols, but how it connects to the alternative destination clinic is certainly, as Director Nichols pointed out, they've already engaged Waterloo Regional Police in this conversation through their impact team. And certainly, I see an alternative destination clinic being available to mental health and addiction patients, regardless of how they arrive at the clinic. So if the police, through their impact team, want to transport to that clinic, that would be totally fine. Or if they wanted to get there by family member, that would be fine as well. That will be up to, obviously, the what the design process spits out for this. But, I'm a big believer in any door is the right door, and let's get patients to the right clinic at the right time with the right help. So that would be my comment. I don't know, Rhonda, do you have anything to add?
I would agree.
Okay,
Thank you very much. That was really helpful.
you're welcome. Thanks.
Thank you, and through you, Chair. Well done. I'm old. I've sat around this horseshoe and a few other horseshoes a long time talking about how we're going to start to make things better. Taking this step forward is huge. I didn't think it would happen in my lifetime. Thank you.
Well, if I may, Mr. Chair, through you, the people that deserve the thanks are Rhonda and Kevin and the team behind us. They're the ones who've worked on this. I'm just the talking head today, so I appreciate that, and we'll be sure to pass on your kind comments to our staff. Thank you.
Thank you for the presentation. This is exciting, and taking us to another level of care in the community, and good luck as you develop it further. Thank you.
Thank you very much.
And that report, this was for information only, required no action at this point. So we are on to the regular agenda. The next item would be 7.1.2, the funding request for the housing stability. And we had so much fun on that. I'm just wondering if we want to do it again, or should we move? No, we'll do it all. Okay. All right. 7.13, a verbal update on the interim housing plan. Now, Mr. Sweeney, you can do that, and Kellyanne and Ryan are still hanging in there.
I will. I'll also be a talking head on this one as well. With respect for your time, I do want to just acknowledge an ongoing monthly appreciation for being flexible to allow us the opportunity to provide a verbal update on the interim housing plan that was approved back in August to allow us to give you the most up-to-date information on a fast-moving file. As you know, it's a comprehensive plan. There are 4 prongs to it tonight. And again, in respect of your time, I will just address one component to that, which is the ongoing development of our outdoor hybrid shelter. So I wanted to provide you a quick update, and in addition to the update I provided, I believe it was 2 weeks ago, I have a couple of slides that I did forward around, so I'll just ask somebody can just throw those up. The first thing I want to acknowledge for council is that this particular body of work is a regional and community priority. It is a priority for our staff. It is a priority for our partners for the working center, and it is a priority for our partners and colleagues in facilities who are helping us make this happen. I will add a little editorial comment. The decision to choose a regionally owned piece of land for the purpose of moving this along as fast as possible was a wise decision, given the amount of work that is going into it and given the amount of control that we have over our own piece of land. I wanted to provide you, maybe if we just go to the next the next slide, just a quick overview on work that is underway and significantly underway on a project that is moving as quickly as we possibly can. Again, as a reminder, the location is right there at 1001 Herbs Road. I want to acknowledge, although our colleagues at Paramedic Services have decided to go grab some dinner, the proximity to the hybrid shelter to the Paramedic Services building. This is quite literally in their front yard, and I want to acknowledge and thank them for their support for the work that we're doing, and I'll mention a little bit more about that in a few seconds. If we can just move to the next slide, I'm just going to run through these very quickly. We did share around a site plan. As you can see, this is not something, I'm no architect and no site planner, but I do know a complicated drawing when I see one that shows that there's a lot of technical work that is going into this to make sure that it is set up that it's set up well, that it's set up with safety and community at the forefront. And so you can see in the center there is a space for community space, and then surrounded by the 50 cabins with a controlled access to the site. At the bottom of that drawing, you can see, so on the right-hand side is the road that goes directly into paramedic services and then into what is commonly referred to as the Res Tech site, which is further back in the back 40, as they might say out in Wilmot. If we can just go to the next slide. This is a rendering, so I believe we've let you know that we have contracted with our partners at Now Housing. This is an organization that is local and we have worked with in the past. I've had the chance to meet the two partners. They are committed to this work. The best way I can describe how I know they're committed to this work is they both showed up to the community meeting to hear the concerns and questions. And for those of you that joined us that evening, I also want to thank you for attending. To me, that showed a real intentionality to be a partner in this work, not just a contractor in this work. If you go to the next slide. I know it's hard to see here, but I did mention that this piece of work, constructing this community space has evolved. It is one of the biggest pieces of work that remains to be done before we can fully occupy the site and begin programming and work with the 50 residents that will ultimately choose to come and join us here. Again, I'm not going to go through it in detail, but you can see that there is space for common areas. There's laundry facilities, there's washrooms and showers, and there's also additional space, private space for our partners at the Working Center and community partners in health and income support to also have private conversations with the people that we're going to serve. The next slide, please. I think this is the last one. I just wanted to give you a little shot that, yes, they are being built as fast as possible. They're about 100, they're 107, Kellyanne, 107 square feet to be exact. They will each have their own bed, a desk, and a dresser. They will be equipped with both air conditioning and heating. There will be a master key, obviously, for the Working Center, but they can be individually locked, and they're also fire rated as well. And again, I want to acknowledge our partners at the City of Waterloo and the Township of Wilmot in working with us to ensure that these are not being built in any sort of haphazard fashion. We're doing the best we can to ensure that they are safe and also provide a dignified place for people to seek shelter. I guess the other thing I would mention in terms of a piece of work, it is also our intention to not only develop an operational plan with the Working Center. That work is still underway. However, we do have I believe a final draft or close to final draft of a memorandum of understanding with the Township of Wilmot and the City of Waterloo. So we're working through your CAO offices, Councillor Sallin and Councillor McCabe as well. So that's almost done as well. Two more things I want to share. We're done with slides. That's okay. Thank you. I mentioned the community feedback center sessions. We held 2 of these sessions. One was in person, as many of you attended. There were approximately 60 folks who attended and asked us really good questions and gave us some really good feedback. And then a week later, we held another session virtually where we had just under 100 attendees. And in that, from my perspective, I guess the other piece of community dialogue that we've had is actually with our colleagues, our co-workers, and our peers at Paramedic Services. A number of us went out to tour to take a look at the site last week, and we sat down with John and team to talk about the impact that this will have on their operations. And the one thing I will share with you that they shared with us is every morning and every evening, half of our paramedic staff start and end their day in that building. And this hybrid shelter is, like I said, it's literally in their front yard. It's not lost on us, and I've shared that back with the staff that paramedic services are on the front line. They referred to some of the work they were doing today, and they engage with this population on a daily basis. And one of the things that I heard loud and clear is that the paramedic services building is their refuge. It is their place of safety and security that they come back to. And so we have committed to working alongside with them to ensure that we work together in supporting this community, both writ large, but also as it relates to that location as well. I was asked a couple of weeks ago if there were opportunities to speed the implementation, the occupancy of the site up in any way. And I'm here to tell you today that given the current situation, the feedback that we've heard from the community, I believe we have multiple stakeholders in this work, but there are three in particular stakeholder groups that I think we have to be very cognizant of as we consider the timing and opening the operation of the hybrid shelter. The first, of course, is the 50 people who will eventually choose to take us up on this offer and call this community their home for a period of time. This is a group of people who we've talked about who have been living unsheltered for months and sometimes years. And while our partners at the Working Centre have already started the process to identify those who might say yes here, we have to make sure that we offer this up and help support people to physically transition and locate out to a place with dignity and with compassion, and not to further traumatize. So getting this done well and built in a place of trust is really, really important. Physical safety is important. There is no alternative for us to move this project along that would not involve asking people to live for a period of time in a construction site. And so there are physical issues to consider, the psychological safety that I mentioned as well, and the confidence by the community. And so the other two stakeholder groups that I think are really important are the neighbors, those who live and work adjacent to this site, and our partners in the region who work at the site, particularly those in paramedic services. And so for those reasons, psychological safety, physical safety, and the ongoing trust and confidence that we need to earn in running a program for the first time in this community as a municipality. I do not, although we've looked at different scenarios, I would propose today that we continue to do the work, that we get this up as fast as we can, and that we don't add additional elements that would see us open this partially finished or with substandard services. And so with that, I will conclude my remarks as quickly as, I didn't do too bad there, but happy to answer any questions related to this work.
Thank you, Mr. Sweeney. Councillor Salon.
Thank you very much. Through you, Chair. Just a quick question. Actually, thank you for the whole update, but quick question on the inside floor plan of the communal space. I was trying to see, but it moved too quickly. Is there a fully accessible washroom in there still?
Yes, there is.
Okay, perfect. Thanks. That's all I need to know.
Okay. And actually, Councillor Salinan, I believe, how many of the cabins are fully accessible, Kellyanne? 5. Yeah, 5 of the 50. Okay. You're welcome.
Councillor McCabe.
Thanks, through you, Chair. Just thanks so much for the update. I just wanted to thank you, Peter, and through you, your staff, the two sitting there, and then of course Joe Mancini, who was at both of the sessions. There were some challenging questions, but I think everyone handled them quite well, particularly the ones that were in person. I attended both of them, as I think you did as well, Councillor Erb. And in chatting afterwards with the local councillors, they're feeling more confident about it. And in chatting with some of the, other neighbors who were there, they're just, the more information they have, it feels like the better they feel about it. So I just want to thank you for putting that effort into it, because I think it's going to pay dividends. So thank you, and we'll continue to move forward.
Thank you. Councillor Vandenbeck.
Thank you very much, and I want to echo my thanks to Mr. Sweeney and the staff team for all the work that's been getting done on this. And I think we all, recognize the sensitivity for the different constituencies that needs to be addressed in terms of seeing this initiative move forward and making sure that we see the best possible outcomes for the affected residents in particular. And so I guess my question in terms of looking at the timing issue and some possible alternatives for the communal space, which is what I understand the main delay is, how do you balance the impact on those residents in terms of continuing to stay potentially in a tented encampment right now versus potentially being in their individual units sooner and looking at some sort of temporary setup for the communal space. And I guess I'm just trying to understand how how we balance those two out and how we also balance it out in terms of the decision by Justice Valente and how he indicated one of the things that he considered in terms of that issue was the need for additional spaces being available. And so the timing of this is pretty important.
Thank you for the questions. The answer to your first question, I would say, for me personally, I balance it out in the total impact of potentially asking 50 people who are living unsheltered to move to a place that is not finished and is not fully equipped. And so considering all elements of safety, I think we owe it to the community we're at large to do this well and to get it right. We wouldn't ask patients to move into a hospital that wasn't fully equipped yet. We wouldn't ask seniors to move into a long-term care facility that didn't have running water, for example. And so the ability to ask people to move into a space that doesn't have community space, that is in the middle of a construction site, we don't think is the right move for that group. And then your second question related to the space and overall how this relates to Justice Valente's work. I guess I would remind everybody again that, I've said this a number of times, this is 50 beds. This is less than 10% of the total shelter system. And we know right now there's over 100 people we believe are sleeping in unsheltered encampment, unsanctioned encampments across Waterloo region. So this in and of itself is not going to change that calculus the moment we open. It moves us further and closer to having more capacity, but it doesn't solve the challenges in and of itself.
So I hear your answers, and I'll maybe leave it at that for today. I mean, I do have some concerns around timelines. Not the first time I've articulated those to you privately and here. And so I guess is there any further update from the last one you provided into timing? The last thing that was said is potentially March, or spring, but spring goes till June 21st, which was what we used for the ION. That's a big difference, and I just want to make sure that I think we need some clarity on that. The community, quite frankly, deserves some clarity.
Agreed. And I also don't want to exacerbate a challenging situation by suggesting something, a date that I'm not sure we can hit. Right now, the project is going along as a project does. That is a priority project. No matter how we cut it, this is the most important project that we're working on in housing. It is the most important project that we're working on in facilities, and everybody has the direction that they need, that this has to move along. We are currently building a community space that is necessary and required, and our partners at Now Housing are building it as fast as they can. We are building a electrical bunker or electrical cabin, and once we have that, we will be asking Hydro to come out and hook it up as fast as they possibly can. So if everything goes according to plan,
like perfectly, we're still targeting that end of March timeline. But I do not want to suggest that it's going to be a specific date and then have to come back and say, we missed it again. We are moving as fast as possible. And I guess the other thing too, Councillor Urbanovic, is yes, you have asked me specifically about other options, and that's why I was trying to be as transparent as I could today. Is I've reviewed some of the options with staff. I've been out to the site, I've talked to the contractors, I've talked to community, and I've talked to our colleagues at paramedics, and I professionally do not believe that we should be putting any interim measures in place to move people to this site before it's ready.
Okay, I'll leave it at that for today.
Just, I've been out to the site 2 or 3 times in the last week, and I can't imagine putting anything temporarily on that site with the site preparation and the work that's going on there that would give any kind of safety or comfort to the people that would be there. I just can't imagine it. Councillor Craig.
Well, thank you, Mr. Chairman. And again, just to sort of reiterate some of the positive comments, going to the public meeting I thought was extremely well handled in spite of some difficult questions from some difficult people, but it was well done. And I think also when I look at this and what we're doing, it certainly is replicating what is happening in other parts of North America in terms of these types of communities of 50 small homes within a certain area. And I think it's a very positive step forward. So after it's in, after we evaluate it, which will take some time, next steps in terms of other communities for building another one. I'm not being specific about which one, but I'm just hinting.
My father used to say you get 3 guesses and the first 2 don't count. Yeah, so thank you for that, Councillor Craig. One of the pieces of feedback we received at that first session that you were in attendance is we were asked if we were going to publicize what our evaluation criteria would look like. And I hadn't actually thought about what that might look like. And so that was really good feedback from the community. So I will reiterate, we have commented publicly that we believe we may need more than one of these. We do want to make sure we get one up and operating, and then I think we would have to come back and say, based on early uptake, what does the community start to look like as we get into the spring, and what can we learn? But I would come back to you. I don't want to commit to a timeline of when we might want to consider another location, but certainly we won't lose track of it, and it won't be far after, I don't believe. You're welcome.
Okay, I don't see any more questions. Thanks very much for the update. Thanks to Ryan and Kellyanne for the work, and Peter and team to move this forward. We're on to the next item on the agenda, which is number 8, which is for information purposes, Council Committee tracking list. We have under other business, we have Councillor Deutschman's notice of motion that was put off from December till now, and I'm going to ask Councillor Deutschman if you want to speak to it.
Yeah, thank you, Chair. I'll be withdrawing the motion in light of all the activity that's been going on, and I just want to reiterate to Peter and his team that I'm in complete agreement with the approach and the speed with which they're doing it, and they have my full support. I'm very happy to see what's been going on, and I think I've been consistent on that point all the way through in my delegations in the past, et cetera, et cetera. So we're moving in the right direction. I'll be withdrawing that motion, and maybe there's matters to be discussed in the future, but for now, not this. Thank you.
Okay, and the consent from committee. Is there consent from committee to withdraw it? Thank you. We don't need to vote on that. Our next meeting is March the 7th. Is there any other business? Have a good and short evening, and we'll see. Oh, sorry. Move. Okay. Oh, thank you. Okay. Moved by Councillor McCabe, seconded by Councillor James. All those in favor? Contrary? Carried. See you in the morning. Yeah.